Knock, knock. Hello, my name is Stephanie and I'm going to be your student nurse for today. I'm going to close the curtain now for patient privacy. I'm gonna wash my hands. Do you have any allergies?
No.
Okay, can I have your first name and last name
Ava Marie.
and your date of birth?
02/17/16.
Okay, let me check your wristbands. Okay, perfect. I'm going to be completing a head to toe on you this morning. Is that okay?
Yes.
Okay, great. Vital signs were done earlier and they were stable. Okay. I'm going to lift the bed up now and I'm going to put the side rail down. How are you feeling today? Do you have any pain?
No.
No pain? Do you know where you are right now? Where are you?
In the hospital.
And do you know what year we're in?
Yes.
What year?
22.
2022, right? Yes. All right. Patient is alert and oriented ×4. Let me apply hand sanitizer. That's okay. Can you sit up for me, please? I'm going to start inspecting the head. Sit up over here. Look straight that way. There you go. Yeah. Okay, I see it's a normal cephalic head. Hair distribution is even, it's well. I don't see any dandruffs, any bumps, any redness. I'm gonna palpate your head and you ask and you let me know if you have any pain. Do you have any pain?
No. Just
No, no pain. Okay. So let me grab my pen right now. Alright, let me check your ears. Okay. They are symmetrical, there's no leakage, no drainage, no redness. Tympanic membrane is pearly gray. I'm going to whisper something in your ear. If you can, just repeat it back to me. Okay.
Car. Vote.
Okay, that's testing cranial nerve number 8. Can you stand up for me, please? I'm going to assess for swaying and balance. Perfect. Can you walk to the end and back for me? Okay, perfect. Now can you sit down for me? Okay, I'm going to check the patient's face now. There is no facial drooping. Everything looks clear and symmetrical. Skin color is appropriate for the patient. Okay, let me check your eyes. Okay, pupils are equal and reactive to light. Okay, we're checking the eyes. Okay, perfect. Yeah, so pupils do accommodate to light. Can you follow the pen light with your eyes?
Yeah.
I'm going to perform the page. And that's testing cranial nerves 3, 4, and 6. Cranial nerve was assessed earlier. Cranial nerve number 2 was assessed earlier using the Snellen chart. Everything was good. Let me check your nose really quick, Mama. The nose, okay. No leakage, no drainage. Mucus is pink. Can you sniff through one nose and then through the other? And then the other. Do you have any trouble breathing? No trouble. Okay, great. Can you close your eyes for me? Can you smell this? What is that? What was that smell?
Perfume.
Perfume. Okay, great. That was testing cranial nerve number 1. Can you open your mouth for me? Stick your tongue out. Move your tongue from side to side. Okay, great. Can you look up for me and swallow? Swallow. Okay, perfect. That was testing cranial nerve 9, 10, and 12. Oh, can you move your eyebrows up and down for me? Up and down. And that would be cranial nerve 5 and 7. Can you smile? Awesome. Okay, great. can you shrug your shoulders up against my hands? Okay, that's testing cranial nerve number 11. Let me start by popping your lymph nodes. Do you have any pain?
No.
Okay, patient has no swelling, no inflammation. Let me see your neck. Okay, I don't see any JVD is noted. Let me auscultate your carotid arteries. Okay. Let me palpate the carotid artery. And then I'm going to start looking up at the patient's upper extremities. Okay, there's no scars, there's no lesions. Skin color is appropriate for the patient. Let me assess for the skin temperature, Mona. Put your hand like this straight. Okay. Okay, skin temperature is fine. I'm going to assess capillary refill. Okay, that was less than 3 seconds. Assessing for skin turgor. Okay. Let me check for brachial pulse and the radial pulse. So brachial, radial.
Oh, what about the capillary refill?
Can you put your hand straight for me? Straight. Yeah. Push down. Okay. Now you're gonna push up. Okay. Push out, and then push in. Okay. Perfect. Can you pull my fingers? Okay. Let me check for the D10 and reflux now. Okay. Okay. All right. Now I'm going to inspect the patient's chest. I don't see any distress while breathing. There's no bumps, no scars, no lesions. Okay, let me start by auscultating the lungs in the front.
Is there a single YouTube gonna get that video?
Sit up straight. Okay, let me do the same in the back. Lung sounds are clear. Yeah, let me auscultate the heart sounds now. Okay, this is the pulmonic, herbs, tricuspid, mitral. Alright, can you lay down? Yes, please. Oh yeah, let me auscultate the apical pulse for 1 full minute. Okay. Patient's apical pulse is 68. I'm going to assess your abdomen and expose it. Patient's stomach is flat and not distended. Can you let me know when was your last bowel movement?
Earlier today.
Okay, earlier today. Was it normal looking? Any weird odor, smell? No, it was fine. Okay. Let me auscultate now the quadrant, starting with the right lower quadrant. Okay, patient has absent bowel sounds. I'm going to percuss the abdomen for tympany and dullness. Now I'm palpating the abdomen. Do you feel any pain? No? Okay. I'm going to start now by looking at the lower extremities. Inspecting the patient's skin. There's no scars, there's no lesions. Hair distribution is well. Going to check the pulses in the lower extremities, the femoral pulse, the popliteal pulse, the dorsalis pedis, and the posterior pedialis.
What about the capillary refill?
And all are even bilaterally. There's no signs of edema. The skin is fine. There's no bumps, no redness. Everything seems fine. Patient is warm to touch. I'm going to check for capillary refill, which is less than 3 seconds. Obviously the sock would be off. Checking for capillary refill, okay? Patient, can you sit up for me, please?
Yeah.
Can you put your feet out? I'm going to assess for range of motion in the lower extremities. Push down for me. Okay, push up, push out, and push in. Awesome. Patient has 5 out of 5 strength in the lower extremities. Do you feel safe at home?
Uh-huh.
Yes. Do you have any suicidal thoughts? No? Okay, great. Do you have any questions for me? No? Okay.
No.
So that concludes my head to toe assessment, and I'm going to document my findings. Oh, you can lay down now. I'm going to lift up the bed, put the side rail up. I'm going to open the curtain. I'm going to wash my hands, sanitize, and that would be me, my completion for my head to toe.
Bye.
Thank you. Bye-bye.